It is time now for this week's Mental Health Moment. A study by the United States Department of Health and Human Services indicates that young people, are more likely to access mental health services in schools than anywhere else. Schools provide a natural setting in which students can get needed supports and services, and where families are comfortable and trusting access to these services. So with us here in studio is to discuss this is Hannah Schlatterbach, a Sweetser school-based clinician. You are based in 2 schools in Harpswell and Brunswick. Thanks so much for joining us, Hannah. We appreciate it. So what does mental health look like for students as someone who is really on the front lines and you do this every day?
Yeah, so usually a referral will come to me from a teacher or a social worker, a school counselor, sometimes the parents themselves when there has been an expressed need that maybe some more in-depth mental health counseling could be beneficial for the kids. Usually the kiddos that I'm working with, maybe they've experienced a trauma, maybe they're working through some grief, they're feeling really anxious or depressed. Oftentimes there are behaviors that have been identified that they're not quite sure what's going on. And so we work together to figure that out so that the school system and the family system has a better idea of what would be helpful for that child going forward.
Is it K through 12?
Yep, so I start with kids in pre-K and up through the 5th grade, but there are school-based clinicians through Sweetser and through other organizations that work all the way up through 12th grade.
And you know, this may seem like a really obvious question, but you know, why is it important to have mental health services available inside of schools? Why is this such a huge thing?
Yeah, you know, I feel really grateful to work within the school system. Both of my parents were and still are teachers inside of public schools in Maine. And I think that it's a really, it is a pre-existing, naturally supportive, safe, non-stigmatizing environment to connect with students. And it's really a team approach. I'm able to connect with the school counselors, the behavior strategists, the teachers, the ESOL staff, sometimes the principals, to figure out together how to best support that child. And so it's a really natural environment. A lot of the kiddos that I work with qualify for Maine Care. So they have a caregiver or caregivers who work really long hours, and they really benefit from having access to mental health services in the school and in collaboration with the pre-existing resources and supports that luckily public schools in Maine have access to.
So you mentioned you work with K through 5th grades. What does that actually look like? So what kind of mental health supports do you give? So you get the referral. What actually happens in a session or when you meet with a child?
Yeah, so it really depends on what's going on for the kiddo. So I'm an expressive arts therapist by training, and so I use a lot of different interventions that are all kind of informed by my expressive arts therapy training. So I'll be doing cognitive behavioral therapy, motivational interviewing, trauma-focused cognitive behavioral therapy, doing a lot of grief work, coping skills, and a lot of what we do is talking about our feelings. They're at such a young age where they're still trying to figure out, what do I feel? Why do I feel that way? How has this been impacted by my past experiences? And how can I express how I'm feeling to the people that care about me so that they can support me with whatever it is that I'm going through?
And I know you can't speak to specifics, but has there ever been, you know, do you have an example or can you think of something where you have intervened or given a child some treatment and it's worked, and what was that?
Yeah, you know, I could share so many stories with you. I'm always so proud of the kiddos that I work with and their families and the whole school environment. But there is one kid who I'd love to talk with you about. He's a really sweet kid. I started working with him in the fall of 2022 when he was in 2nd grade. He was and still is very creative, very artistic, very funny, very active, very athletic, and also carried a lot of anger. He had a lot of negative thoughts about himself, and the thing that everyone was the most concerned about is that he was often really sad as a 7-year-old and expressed not liking himself sometimes. So we met every week for that first school year. We would start with a bucket metaphor. I would ask him how full his bucket was, and almost every week for that first year, he would put his hand down at his ankle and say, "I'm down here." And he worked really hard. I was so proud of him. I worked really closely with his family. I worked in collaboration with the whole school, who also really cared very deeply about him. And he was, before the school let out for the summer, last summer, he was able to identify that he really felt misunderstood. He felt that he had been pegged as a bad kid, that he was incapable of making smart and healthy choices, and that he oftentimes rejected others before they would reject him. And so we worked collaboratively to figure out a better path forward. And so his family, over the summertime, attended regular family therapy. He has a really loving, very strong, close-knit family. They were able to figure out how to love and support him the way that he was able to communicate that he needed to be loved and supported. One of the things that was going on at the school, like so many kids his age, is when you have really big feelings that are hard to manage, that comes out behaviorally. And so a lot of schools see that as kind of getting into trouble at school, where kids are needing to be following rules in a specific way, and that can be really hard. Sure. And so because I was able to share a lot of this with the school, whatever he told me would be okay to share, we were able to make some really great progress. He was able to make really great progress. So he just started his second semester of third grade. He's gone a couple of months without any behavior slips. He's actively playing with his peers on the playground, which was something that was hard for him to do previously. And he's expressing feeling just so much happier. When we do the bucket metaphor these days, he almost always puts his hand near his head or around his head and says that he's up there.
That's really great to hear.
Yeah.
Thank you so much for coming on the show, Hannah.
Yeah.
Clearly, what you do really matters, and we appreciate the fact that we can tell our audience about that as well.
Thank you. Yeah, thanks for having me.
We appreciate that, and we'll be right back.